Chapter 24. Communication. Nurses play a vital role in communication. Their ability to relay and interpret information between the provider, the patient, caregivers, and family members is key in preventing medical mistakes and ensuring patient safety. Communication and the nursing process. Communication is a lifelong learning process for nurses. As a nurse, you communicate with patients and families to develop meaningful relationships. Within those relationships, you collect relevant assessment data, provide education, and interact during nursing interventions. Communication is the key to nurse-patient relationships and the ability to deliver patient-centered care. Patient safety also requires effective communication among members of the healthcare team, as patients move from one caregiver to another, or from one care setting to another. Good communication skills help to reduce the risk of errors. Competency in communication maintains effective relationships within the entire sphere of professional practice, and meets legal, ethical, and clinical standards of care. All behavior communicates, and all communication influences behavior. Nurses with expertise in communication express caring by 1. Becoming sensitive to self and others. 2. Promoting and accepting the expression of positive and negative feelings. 3. Developing caring relationships. 4. Instilling faith and hope. 5. Promoting interpersonal teaching and learning. 6. Providing a supportive environment. 7. Assisting with gratification of human needs. And 8. Allowing for spiritual expression. Relating to others includes the ability to take the initiative in establishing and maintaining communication, to be authentic, and to respond appropriately to the other person. Effective interpersonal communication also requires a sense of mutuality. For example, a belief that the nurse-patient relationship is a partnership and that both are equal participants. The Joint Commission recognizes the need to promote effective communication for patient-centered care, family-centered care, cultural competence, and improved patient safety. The Joint Commission initiated a set of standards for hospitals that promote these improvements in communication, and they became part of the TJC requirements. Nurses should be aware that communication, including posture, expressions, gestures, words, and attitudes, has the power to hurt or to heal. Skilled communication empowers others to express what they believe and make their own choices. These are essential aspects of the individualized healing process. Developing communication skills. Gaining expertise in communication requires both an understanding of the communication process and reflection about one's communication experiences as a nurse. Nurses who develop critical thinking skills make the best communicators. They draw on theoretical knowledge about communication and integrate this knowledge with knowledge previously learned through personal clinical experience. They interpret messages received from others to obtain new information, correct misinformation, promote patient understanding, and assist with planning patient-centered care. When you consider a patient's problems, it is important to apply critical thinking and critical reasoning skills to improve communication in assessment and care of the patient. Perseverance and creativity are also helpful because they motivate a nurse to identify innovative solutions. Patients respond more readily to a self-confident attitude. Integrity allows nurses to recognize when their opinions conflict with those of their patients, review positions, and decide how to communicate to reach mutually beneficial decisions. An attitude of humility is necessary to recognize when you need to better communicate and intervene with patients, especially related to their cultural needs. Each individual bases his, or her, perceptions about information received through the five senses: sight, hearing, taste, touch, and smell. An individual's culture and education also influence perception. People often incorrectly assume that they understand an individual's culture. They tend to distort, or ignore, information that goes against their expectations, preconceptions, or stereotypes. Critical thinking helps nurses overcome perceptual biases or stereotypes that interfere with accurately perceiving and interpreting messages from others. By thinking critically about personal communication habits, you learn to control these tendencies and become more effective in interpersonal relationships. You also learn to integrate communication skills throughout the nursing process as you collaborate with patients and healthcare team members to achieve goals. Patients often experience high levels of anxiety when they are ill or receiving treatment. Emotional intelligence is an assessment and communication technique that allows nurses to better understand and perceive the emotions of themselves and others. Emotional intelligence also enables the nurse to use self-awareness, motivation, empathy, and social skills to build therapeutic relationships with patients. Please review Box 24.1, Communication throughout the nursing process, and Box 24.2, Challenging communication situations, as a supplement to this PowerPoint. Levels of communication. Interpersonal communication is a powerful form of communication that you use as a professional nurse. This level of communication is also called self-talk. People's thoughts and inner communications strongly influence perceptions, feelings, behavior, and self-esteem. Nurses use interpersonal communication to develop self-awareness and a positive self-esteem that enhances appropriate self-expression. Interpersonal communication is one-on-one interaction between a nurse and another person that often occurs face-to-face. It is the level most frequently used in nursing situations and lies at the heart of nursing practice. Meaningful interpersonal communication results in an exchange of ideas, problem-solving, expression of feelings, decision-making, goal accomplishment, team building, and personal growth. Small group communication is the interaction that occurs when a small number of people meet. This type of communication is usually goal-directed and requires an understanding of group dynamics. Public communication is interaction with an audience. Nurses often speak with groups of consumers about health-related topics, present scholarly work to colleagues at conferences, or led classroom discussions with peers or students. Electronic communication is the use of technology to create ongoing relationships with patients and their healthcare team. Secure messaging provides an opportunity for frequent and timely communication with a patient's physician or nurse via patient portal. Time for a quick quiz. Match the levels of communication. The answers will be provided on the next slide. Number 1. Interpersonal is B. Occurs within an individual. Number 2. Interpersonal is A. One-to-one interaction between two people. Number 3. Transpersonal is D. Interaction within a person's spiritual domain. Number 4. Small group is E. Interactions with a small number of people. N. Number 5. Public is C. Interaction with an audience. Quick quiz continued. You are invited to attend the weekly unit patient care conference during which the staff discusses patient care issues. This type of communication is A. Public, B. Interpersonal, C. Transpersonal, or D. Small group. The answer is D. Rationale. Nurses or other disciplines participate in patient care conferences, and they use a small group communication process. Communication in these situations should be organized, concise, and complete. Elements of the communication process. Communication is an ongoing and continuously changing process. You are changing. The people with whom you are communicating are changing, and your environment is also continually changing. This simple linear model represents a very complex process with its essential components. The circular transactional model includes the following elements: the referent, sender and receiver, message, channels, context or environment in which the communication process occurs, feedback, and interpersonal variables. In this model, each person in the communication interaction is both a speaker and a listener, and can be simultaneously sending and receiving messages. Both parties view the perceptions, attitudes, and potential reactions to a sent message. Feedback from the receiver or environment enables the communicators to correct or validate the communication. This model also describes the role relationship of the communicators as complementary and symmetrical. Complementary role relationships function with one person holding an elevated position over the other person. Symmetrical relationships are more equal, shown as Figure 24.1. Circular transactional model of communication. Circular transition model. The referent motivates one person to communicate with another. In a healthcare setting, sights, sounds, sensations, perceptions, and ideas are examples of cues that initiate the communication process. The sender is the person who encodes and delivers a message, and the receiver is the person who receives and decodes the message. The more the sender and receiver have in common, and the closer the relationship, the more likely they will accurately perceive one another's meaning and respond accordingly. The message is the content of the communication. It contains verbal and nonverbal expressions of thoughts and feelings. Effective messages are clear, direct, and in understandable language. Communication channels are means of sending and receiving messages through visual, auditory, and tactile senses. Facial expressions send visual messages, and spoken words travel through auditory channels. Touch uses tactile channels. Individuals usually understand a message more clearly when the sender uses more than one channel to send it. Feedback is the message a receiver receives from the sender. It indicates whether the receiver understood the meaning of the sender's message. Interpersonal variables are factors within both the sender and receiver that influence communication. Perception provides a uniquely personal view of reality formed by an individual's culture, expectations, and experiences. Each person senses, interprets, and understands events differently. The environment is the setting for sender-receiver interaction. An effective communication setting provides participants with physical and emotional comfort and safety. Time for a quick quiz. Match the correct definition with each of the basic elements of communication. The answers will be on the next slide. One. Referent. Motivates one to communicate with another. 2. Sender and receiver is one who encodes and one who decodes the message. 3. Message is the content of the message. 4. Channels are the means of conveying and receiving messages. 5. Feedback is message the receiver returns. 6. Interpersonal variables are factors that influence communication. And 7. Is environment, the setting for sender-receiver interactions. Verbal communication uses spoken or written words. Verbal language conveys specific meanings through the combination of words. Communication is unsuccessful if senders and receivers cannot translate each another's words and phrases. When you care for a patient who speaks another language, a professional interpreter is necessary. Limiting the use of medical jargon or unapproved abbreviations with other healthcare team members also improves communication. The connotative meaning is the shade or interpretation of the meaning of a word influenced by the thoughts, feelings, or ideas that people have about the word. You need to select words carefully, avoiding easily misinterpreted words, especially when explaining a patient's medical condition or therapy. Conversation is more successful at an appropriate speed or pace. Speak slowly and enunciate clearly. Talking rapidly, using awkward pauses, or speaking slowly and deliberately conveys an unintended message. Long pauses and rapid shifts to another subject give the impression that you are hiding the truth. Think before speaking. Tone of voice dramatically affects the meaning of a message. Be aware of voice tone to avoid sending unintended messages. Effective communication is simple, brief, and direct. Repeating important parts of a message also clarifies communication. Timing is critical in communication. Even though a message is clear, poor timing prevents it from being effective. Patients report improved satisfaction, understanding, and perception of safety with registered nurses who provided a bedside handoff and communicate information about the plan of care. Nonverbal communication includes the 5 senses, and everything that does not involve the spoken or written word. Nonverbal communication is unconsciously motivated, and more accurately indicates a person's intended meaning than spoken words. Because the meaning attached to nonverbal behavior is so subjective, it is imperative that you verify it. Personal appearance includes physical characteristics, facial expression, and manner of dress and grooming. These factors communicate physical well-being, personality, social status, occupation, religion, culture, and self-concept. Posture and gait are forms of self-expression. The way people sit, stand, and move reflects attitudes, emotions, self-concept, and health status. Facial expressions convey emotions such as surprise, fear, anger, happiness, and sadness. Patients closely observe nurses. Although it is hard to control all facial expressions, try to avoid showing shock, disgust, dismay, or other distressing reactions in a patient's presence. People signal readiness to communicate through eye contact. Maintaining eye contact during conversation shows respect and willingness to listen. Lack of eye contact may indicate anxiety, defensiveness, discomfort, or lack of confidence in communicating. Always consider a person's culture when interpreting the meaning of eye contact. Gestures emphasize, punctuate, and clarify the spoken word. Gestures alone carry specific meanings, or they create messages with other communication cues. Sounds such as sighs, moans, groans, or sobs also communicate feelings and thoughts. Combined with other nonverbal communication, sounds help to send clear messages. Territoriality is the need to gain, maintain, and defend one's right to space. Territory is important because it provides people with a sense of identity, security, and control. Meta-communication is a broad term that refers to all factors that influence communication. Awareness of influencing factors helps people better understand what is communicated. Please review Box 24(3), Zones of Personal Space, as a supplement to this PowerPoint. Nurse-patient relationship. Caring relationships are the foundation of clinical nursing practice. Therapeutic relationships promote a psychological climate that facilitates positive change and growth. The goals of a therapeutic relationship focus on a patient achieving optimal personal growth related to personal identity, ability to form relationships, and ability to satisfy needs and achieve personal goals. Patient's needs take priority over a nurse's needs. Your non-judgmental acceptance of a patient is an important characteristic of the relationship. Acceptance conveys a willingness to hear a message, or acknowledge feelings. A caring relationship between you and a patient does not just happen, you create it with skill and trust. There is a natural progression of 4 goal-directed phases that characterize the nurse-patient relationship. Phase 1, pre-interaction phase, occurs before meeting the patient. Phase 2, the orientation phase, occurs when the nurse and the patient meet and get to know each other. Phase 3, the working phase, occurs when the nurse and the patient work together to solve problems and accomplish goals. And Phase 4, the termination phase, occurs at the end of a relationship. Socializing is an important initial component of interpersonal communication. It helps people get to know one another and relax. It is easy, superficial, and not deeply personal, whereas therapeutic interactions are often more intense, difficult, and uncomfortable. In a therapeutic relationship, it may be helpful to encourage patients to share personal stories. Sharing stories is called narrative interaction. Through listening to stories, you begin to understand the context of others' lives and learn what is meaningful for them from their own perspective. As a nurse, you can also tell stories to enhance patient education. Motivational interviewing is a technique that holds promise for encouraging patients to share their thoughts, beliefs, fears, and concerns with the aim of changing their behavior. It can provide a way of working with patients who may not seem ready to make behavior changes that are considered necessary by their health practitioners. It can potentially be used to evoke change talk, which links to improved patient outcomes. When using motivational interviewing, a nurse tries to understand a patient's motivations and values using an empathic and active listening approach. The nurse identifies differences between the patient's current health goals and behaviors and his or her current health status. The patient is supported even though a phase of resistance and ambivalence often occurs. Communication then focuses on recognizing the patient's strengths and supporting those strengths in an effort to make positive changes. This can result in dramatic improvements in health outcomes and patient satisfaction. The same principles that guide one-on-one helping relationships apply. when the patient is a family unit. Although communication within families requires additional understanding of the complexities of family dynamics, needs, and relationships, communication with other members of the healthcare team affects patient safety and the work environment. Breakdown in communication, lack of patient education, and poor healthcare provider accountability is a frequent cause of serious injuries in healthcare settings. The Joint Commission Resources recommends that the entire healthcare team collaborate and coordinate during patient transition, standardize discharging of patients, or transfer procedures and forms reduce the risk of errors during patient transitions. Evidence-based practice has identified some of the nursing actions that increase the effectiveness of nurse-to-nurse interaction and interprofessional communication. Lateral violence, or workplace bullying, between colleagues sometimes occurs, and includes behaviors such as withholding information, backbiting, making snide remarks, or put-downs, and nonverbal expressions of disapproval, such as raising eyebrows or making faces. The nurse experiencing lateral violence can also use additional techniques such as the following. 1. Address the behavior when it occurs in a calm manner. 2. Describe how the behavior affects your functioning. 3. Ask for the abuse to stop. 4. Notify the manager to get support for the situation. 5. Make a plan for taking action in the future. Or 6. Document the incidences in detail. Many nurses form relationships with community groups by participating in local organizations, volunteering for community service, or becoming politically active. As a nurse, you must learn to establish relationships with your community to be an effective change agent. Case study. Roberto Ruiz is a 44-year-old man of Puerto Rican descent, suffering from HIV and AIDS. He was near death and in hospice, but his condition has improved, and he is now home. Suzanne is a 54-year-old nurse dedicated to hospice and committed to maximizing quality of life in end-of-life care. What are some important communication areas for Suzanne and Roberto? Topics of discussion should include: what are your needs at this time? And what are your concerns now and for the future? Time for a quick quiz. Helping relationships serve as the foundation of clinical nursing practice. Contracts for a therapeutic helping relationship are formed during the A. Orientation stage, B. Working stage, C. Termination stage, or D. Pre-interaction stage. The answer is A. During the stage when the patient and nurse get to know one another and form contracts with the patient that specify who will do what, is the orientation stage. Elements of professional communication. A professional is expected to be clean, neat, well-groomed, conservatively dressed, and odor-free. Professional behavior reflects warmth, friendliness, confidence, and competence. Professionals speak in a clear, well-modulated voice, use good grammar, listen to others, help and support colleagues, and communicate effectively. Common courtesy is part of professional communication. To practice courtesy, say hello and goodbye to patients, and knock on doors before entering. Professional appearance, demeanor, and behavior communicate that you have assumed the professional helping role, are clinically skilled, and are focused on your patients. Common courtesy is part of professional communication. Always introduce yourself. Failure to give your name and status, or to acknowledge a patient, creates uncertainty about the interaction, and conveys an impersonal lack of commitment or caring. To foster trust, communicate warmth, and demonstrate consistency, reliability, honesty, competence, and respect. Autonomy is being self-directed and independent in accomplishing goals and advocating for others. Professional nurses make choices and accept responsibility for the outcomes of their actions. Assertiveness allows you to express feelings and ideas without judging or hurting others. Assertive behavior includes intermittent eye contact, nonverbal communication that reflects interest, honesty, and active listening, spontaneous verbal responses with a confident voice, and culturally sensitive use of touch and space. Case study continued. As Suzanne works with Roberto, she develops a helping relationship. Suzanne knows that posing questions for the patient's reflection helps her assess his needs and support his self-care strategies. A helping relationship between you and your patient does not just happen. You create it with care and skill, and build on the patient's trust in you as a nurse. You help patients to clarify needs and goals, solve problems, and cope with situational or maturational crises. Creating this therapeutic environment depends on your ability to communicate, provide comfort, and help the patient meet his or her needs. During the assessment process, thoroughly assess each patient and critically analyze findings to ensure that you make patient-centered clinical decisions. Patient-centered care requires careful assessment of a patient's values, preferences, and cultural, ethnic, and social backgrounds. If the nurse cannot resolve his or her bias related to a patient, care should be transferred to another individual. Internal and external factors can also affect a patient's ability to communicate. It is especially important to assess the psychophysiological factors that influence communication. Many altered health states and human responses limit communication. Review of a patient's medical record provides relevant information about his or her ability to communicate. Aspects of a patient's growth and development also influence nurse-patient interaction. Adapt communication techniques to the special needs of infants and children and their parents. Age alone does not determine an adult's capacity for communication. Hearing loss and visual impairments are changes that may occur during aging that contribute to communication barriers. Simple measures facilitate communication with older individuals who have hearing loss. Culture influences thinking, feeling, behaving, and communicating. Be aware of the typical patterns of interaction that characterize various ethnic groups, but do not allow this information to bias your response. Gender influences how we think, act, feel, and communicate. For example, men tend to use less verbal communication but are more likely to initiate communication and address issues more directly. They are also more likely to talk about issues. Women tend to disclose more personal information and use more active listening and answering with responses that encourage the other person to continue the conversation. Please review Box 24(6), Assessment, Factors Influencing Communication, and Box 24(8), Cultural Aspects of Care, Communication with Non-English Speaking, as a supplement to this PowerPoint. Case study continued. Suzanne learns that Roberto wants to travel to New York to see his extended family. Even though Roberto is in poor health, and the trip will be difficult, Suzanne expresses her understanding of the importance of the trip. She understands how important extended family is in the Puerto Rican culture. What is Suzanne demonstrating? Suzanne is demonstrating her understanding of the importance of the extended family in the Puerto Rican culture. By doing this, it helps her appreciate the importance of the trip to New York. Nursing diagnosis. Remember that impairment of communication can be physiological, mechanical, anatomical, psychological, cultural, or developmental. The primary nursing diagnostic label used to describe a patient with limited or no ability to communicate verbally is impaired verbal communication. This is the state in which an individual experiences a decreased, delayed, or absent ability to receive, process, transmit, and use symbols for a variety of reasons. The defining characteristics for this diagnosis include the inability to articulate words, inappropriate verbalization, difficulty forming words, and difficulty comprehending. These should be clustered together to form the diagnosis. Although a patient's primary problem is impaired verbal communication, the associated difficulty in self-expression, or altered communication patterns, may contribute to other nursing diagnoses such as anxiety, social isolation, ineffective coping, compromised family coping, powerlessness, and impaired social interaction. Related factors for a nursing diagnosis focus on the causes of the communication disorder. Planning. Once a diagnosis has been identified, select a goal that is relevant and achievable for the patient, such as being able to express needs or achieving understanding of physical condition. Next, select expected outcomes that are very specific and measurable. Outcomes for the patient possibly include the following. 1. Patient initiates conversation about diagnosis or health care problem. 2. Patient is able to attend to appropriate stimuli. 3. Patient conveys clear and understandable messages with healthcare team. And 4. Patient expresses increased satisfaction with the communication process. Setting priorities means always maintaining an open line of communication. Also ensure the patient is comfortable, and that all physical needs have been met. When you plan to have lengthy interactions with a patient, it is important to address physical care priorities first, so the discussion is not interrupted. Teamwork and collaboration with other healthcare providers may be necessary if the patient has problems with communication. Case study continued. During her visit, Roberto tells Suzanne, "I really want to go visit my uncles in New York, but I'm not sure I'm up for the trip." Suzanne is understanding and states, "It sounds like you miss your family. Let's talk about your options for maintaining contact." As they talk, Suzanne helps Roberto to identify methods of communicating with his family in New York. Implementation. Therapeutic communication techniques are specific responses that encourage the expression of feelings and ideas and convey acceptance and respect. Communication techniques need to be used to prevent barriers when rendering care to patients. Effective communication techniques are facilitative and tend to encourage the other person to openly express ideas, feelings, or concerns. Active listening means being attentive to what a patient is saying both verbally and non-verbally. Use the mnemonic SOLAR. Sit facing the patient. Observe an open posture. Lean toward the patient. Establish and maintain intermittent eye contact, and relax. Nurses make observations by commenting on how the other person looks, sounds, or acts. Stating observations often helps a patient communicate without the need for extensive questioning, focusing, or clarification. Empathy is the ability to understand and accept another person's reality, accurately perceive feelings, and communicate this understanding to the other. Nurses recognize that hope is essential for healing and learn to communicate a sense of possibility to others. Appropriate encouragement and positive feedback are important in fostering hope and self-confidence, and for helping people achieve their potential and reach their goals. Humor is an important, but often underused resource in nursing interactions. It is a coping strategy that can reduce anxiety and promote positive feelings. Patients use humor to release tension, cope with fear related to pain and suffering, communicate a fear or need, or cope with an uncomfortable or embarrassing situation. Emotions are subjective feelings that result from one's thoughts and perceptions. Feelings are not right, wrong, good, or bad, although they are pleasant or unpleasant. If individuals do not express feelings, stress and illness may worsen. Touch is one of the most potent and personal forms of communication. It expresses concern or caring to establish a feeling of connection and promote healing. Comfort touch, such as holding a hand, is especially important for vulnerable patients who are experiencing severe illness with its accompanying physical and emotional losses. Nurses need to be aware of patients' nonverbal cues and ask permission before touching them to ensure that touch is an acceptable way to provide comfort. Silence prompts some people to talk. It allows a patient to think and gain insight. Remaining silent demonstrates patience and a willingness to wait for a response when the other person is unable to reply quickly. Providing relevant information tells other people what they need or want to know so they are able to make decisions, experience less anxiety, and feel safe and secure. It is also an integral aspect of health teaching. To check whether you understand a message accurately, restate an unclear or ambiguous message, to clarify the sender's meaning. In addition, ask the other person to rephrase it, explain further, or give an example of what the person means. Focusing involves centering a conversation on key elements or concepts of a message. If conversation is vague or rambling, or patients begin to repeat themselves, focusing is a useful technique. Paraphrasing is restating another's message more briefly using one's own words. Through paraphrasing, you send feedback that lets a patient know that he or she is actively involved in the search for understanding. Validation is a technique that nurses use to recognize and acknowledge a patient's thoughts, feelings, and needs. Patients and families know they are being heard and taken seriously when the caregiver addresses their issues. Nurses ask relevant questions to seek information needed for decision-making. Ask only one question at a time, and fully explore one topic before moving to another area. Use both open-ended and closed-ended questions. Asking too many questions is sometimes dehumanizing. Summarizing is a concise review of key aspects of an interaction. It brings a sense of satisfaction and closure to an individual conversation, and is especially helpful during the termination phase of a nurse-patient relationship. Self-disclosures are subjectively true personal experiences about the self that are intentionally revealed to another person. This is not therapy for a nurse, Rather, it shows a patient that the nurse understands his experiences, and that they are not unique. When you confront someone in a therapeutic way, you help the other person become more aware of inconsistencies in his or her feelings, attitudes, beliefs, and behaviors. Certain communication techniques hinder or damage professional relationships. These specific techniques are referred to as non-therapeutic or blocking, and often cause recipients to activate defenses to avoid being hurt or negatively affected. Asking personal questions that are not relevant to a situation simply to satisfy your curiosity is not appropriate professional communication. When a nurse gives a personal opinion, it takes decision-making away from the other person. It inhibits spontaneity, stalls problem-solving, and creates doubt. Changing the subject when another person is trying to communicate his or her story is offensively inappropriate and shows a lack of empathy. It blocks further communication, and the sender then withholds important messages or fails to openly express feelings. Stereotypes are generalized beliefs held about people. Making stereotypical remarks about others reflects poor nursing judgment and threatens nurse-patient or team relationships. When a patient is reaching for understanding, false reassurance discourages open communication. Offering reassurance not supported by facts or based in reality does more harm than good. Sympathy is concern, sorrow, or pity felt for another person. A nurse, unfortunately, often takes on a patient's problems as if they were his or her own. Some nurses are tempted to ask patients why they believe, feel, or act in a certain way, regardless of a patient's perception of your motivation. Asking why questions causes resentment, insecurity, and mistrust. Do not impose your own attitudes, values, beliefs, and moral standards on others while in the professional helping role. Other people have the right to be themselves and make their own decisions. Judgmental responses often contain terms such as should, ought, good, bad, right, or wrong. Becoming defensive in the face of criticism implies that the other person has no right to an opinion. The sender's concerns are ignored when the nurse focuses on the need for self-defense, defense of the healthcare team, or defense of others. Passive responses serve to avoid conflict or sidestep issues. They reflect feelings of sadness, depression, anxiety, powerlessness, and hopelessness. Aggressive responses provoke confrontation at the other person's expense. They reflect feelings of anger, frustration, resentment, and stress. Challenging or arguing against perceptions denies that they are real and valid. Adapting communication techniques. Interacting with people who have conditions that impair communication such as visual or hearing impairment requires special thought and sensitivity. Such patients benefit greatly when you adapt communication techniques to their unique circumstances, developmental level, or cognitive and sensory deficits. A nurse directs actions toward meeting the goals and expected outcomes identified in the plan of care, addressing both the communication impairment and its contributing factors. Effective communication involves adapting special needs resulting from sensory, motor, or cognitive impairments. Encouraging older adults to share life stories, reminisce about the past, has a therapeutic effect and increases their sense of well-being. Patients with impaired verbal communication require special consideration and alterations in communication techniques to facilitate sending receiving, and interpreting messages. Please review Box 24-9, Communicating with Patients Who Have Special Needs, as a supplement to this PowerPoint. Time for a quick quiz. While admitting a patient, during the initial interview, a family member tells you, "My mom really means that she does not understand her medical diagnosis." The communication form used by the family member is A. Focusing, B. Clarifying, C. Summarizing, or D. Paraphrasing. The answer is B. Clarifying. When someone, like a family member of a patient, tries explaining what they believe the patient means, the person is clarifying to ensure the nurse understands. Evaluate the effectiveness of your own communication by videotaping practice sessions with peers, or by making process recordings. You and your patient determine the success of the plan of care by evaluating patient communication outcomes together. You determine which strategies or interventions were effective, and which patient changes such as behaviors or perceptions resulted because of the interventions. If expected outcomes are not met, the plan of care needs to be modified. Evaluation of the communication process helps nurses gain confidence and competence in interpersonal skills. Becoming an effective communicator greatly increases your professional satisfaction and success. There is no skill more basic, no tool more powerful than communication. Please review Box 24-10, Sample Communication Analysis, as a supplement to this PowerPoint.